The implementation phase of the National Strategy for the Reduction and Prevention of Chronic Non-Communicable Diseases has begun, says Health Minister Ronnie Skelton. Chronic diseases are the #1 cause of premature death in the Caribbean. They include diabetes, lung diseases, heart diseases, stroke, and cancer. Delivering ministerial statement to the House of Assembly on December 17th, Minister Skelton said a short-term action plan has been developed for the reduction and prevention of chronic diseases with timelines through the year 2016.
This plan coordinates the activities to be undertaken by selected public and private sector agencies. 4 community-based health and wellness committees have already been formed. 1 in Eastern Longloop, 1 in Bellevue, Hope Hill, and Long Trench area, Cane Garden Bay and the surrounding community, as well as on Borgingada. Madam Speaker, the goal of these wellness committees is to promote and coordinate community-led activities such as backyard gardening, healthy cooking, physical fitness activities, while empowering individuals in the community to take responsibility for their health and make healthier lifestyle choices. Madam Speaker, these committees will be fine-tuned and duplicated throughout the territory. Just a few weeks ago, Madam Speaker, Mr. Jim Dyers of Neighbor Power from Seattle, Washington, was in the territory to provide training for members of government and civil society on effective ways of mobilizing and building healthy communities. Madam Speaker, the Ministry, in collaboration with the BVI Health Services Authority, has also created a chronic disease management committee in support of the holistic national health strategy.
Presenting a 6-page update on government's national health strategy, Health Minister Ronnie Skelton listed the improvements at the BVI Health Services Authority. He said the HSA is currently conducting a full assessment project to improve all services offered to patients, and that specific initiatives have already been implemented to improve the quality of care and customer service. Among them are the pharmaceutical unit to improve the availability of essential and new medicines in the territory, continued medical education sessions to keep the medical practitioners up to date on new information techniques and treatment methods, and to identify medical gaps. A risk manager in the quality improvement unit to review all complaints. A quality assurance manager to educate BVI HSA staff on best practices in patient and employee safety. And the health information system, electronic medical records, that began in 2012 is at 95% completion. The Health Minister said government has also begun work to develop an efficient and effective solid waste management system for the Virgin Islands through an agreement with Egar and Associates of Trinidad and Tobago.
We have recognized the need to develop an efficient and effective solid waste management system for the Virgin Islands. That is why on 12th December 2012, we entered into an agreement with Egar and Associates of Trinidad and Tobago. The 2 overall objectives of the consultancy were to A, conduct a situational analysis of waste management in the territory and identify sustainable and affordable options for waste management solutions that are in line with the territory's development agenda. And B, develop a solid waste management strategy and plan for the improvement of collection, transfer as needed, recycling, disposal of solid waste in the territory, including the analysis of applicable options, costs, and time frames, as well as economic, political, and social consideration for each viable option. Madam Speaker, I am pleased to report that a consultant's report has been submitted, and we hope to work towards a phased implementation of its recommendations.
The Health Minister also spoke of the pilot program for door-to-door garbage collection in Eastern Tortola that started in August this year. A pilot program for recycling, waste education, and community outreach has started on Virgin Gorda since July 2013 with strategically placed recycled garbage bins with the hopes of extending the recycling program on Tortola during next year. He said the open burning of waste on Jos van Dyke is expected to end with the construction of the Jos van Dyke waste transfer station to be completed in early January. Government also plans to address the open burning of garbage on Gorda Peak in Virgin Gorda and in the pond area in Anegada.